All so much for being here. The Senate Health, Education, Labor, and Pensions Subcommittee on Primary Health and Retirement Security will come to order. Thank you all for joining us today for the hearing, Avoiding a Cautionary Tale, Policies, Considerations for Artificial Intelligence in Healthcare. And thank you to Ranking Member Marshall for your continued partnership, your staff's continued partnership on the subcommittee. We're hearing more and more about the promise of artificial intelligence in healthcare, the potential for innovation to reduce the red tape facing patients and providers, to identify patterns, improve patient outcomes, and cure disease. But we've heard grand promises from big tech before. In 2012, Mark Zuckerberg compared social media to the printing press and explained that Facebook was built to make the world more open and more connected. But here's the unfortunate truth. Big tech made big promises for innovation, democracy, and community, but instead unleashed big problems on the American people without solutions that were attached by big tech. And our young people have suffered the most. In 2021, 1 in 3 high school girls seriously considered suicide, and at least 1 in 10 high school girls attempted suicide that year, 2021. Among LGBTQ youth, the number was more like 1 in 5 attempted suicide in 2021. And as U.S. Surgeon General Dr. Vivek Murthy concluded in a CDC report earlier this year, there is significant evidence that big tech's predatory practices contributed significantly to this youth mental health crisis. That's why I'm working to pass my bipartisan Children and Teens Online Privacy Protection Act with Senator Cassidy to ensure children and teenagers and their parents have the tools they need when kids are searching and scrolling and connecting online. Fast forward 10 years from when Mark Zuckerberg made his rose-colored promise, and look at our approach to artificial intelligence. And I have concerns, because when we talk about the promises of AI, we need to also talk about its risks. We have learned time and again that left to self-regulate, big tech puts profit over people almost every time. We cannot afford to repeat that mistake by not regulating artificial intelligence now. The risks are too great. Unregulated experimentation involving artificial intelligence may fuel our next pandemic. Humans insert human bias and discrimination into algorithms that can supercharge existing inequalities in our healthcare system, jeopardize our privacy, and misdiagnose or mistreat patients. Big tech's access to sensitive patient information without guardrails exposes people to their most personal information being shared, or even worse, weaponized back against them. Automated review processes will speed up insurance reviews and denials, leaving patients scrambling to get the health coverage they need to avoid choosing between their care and bankruptcy. And amid all of this, health workers are on the front lines of implementing this powerful technology without proof of safety, reliability, effectiveness, or equity. Workers are seeing health systems replace conversations on retaining and paying the workforce with extending and replacing them using artificial intelligence. We don't need big tech treating our healthcare system like a lab to experiment on patients and workers. We need a healthcare system that prioritizes people over heart rhythms, over bots run by algorithms. Artificial intelligence must be paired with a voice for workers in determining their own working conditions, more treatments and cures for all patients, and better access to health care. Otherwise, we are innovating for the sake of profit, and that isn't really innovation at all. It is greed. We can act now to prevent the next cautionary tale. We can pass by legislation, the Artificial Intelligence and Biosecurity Risk Assessment Act with Senator Budd, and the Securing Gene Synthesis Act with Representative Eshoo to require the U.S. Department of Health and Human Services to identify and respond to biosecurity threats involving AI. We can stop corporations from implementing technologies on patients and workers without their knowledge and without appropriate testing to prevent harm, discrimination, or interference with their clinical judgments. We can guarantee that workers and patients have a voice in whether and how artificial intelligence is used. We can guarantee civil rights protection in the utilization of artificial intelligence. We can protect young people from big tech's targeting and tracking and pass a comprehensive privacy bill of rights for teenagers and children in our country. And we have to guarantee that wherever artificial intelligence is used, it prioritizes people over profits. What I've learned in my many years serving on the Telecommunications Committee, I was chairman in the House and I'm the author of all of the bills moving us from analog to digital in America, from narrowband to broadband. Those are all my bills, breaking down all the monopolies. What I learned was the only time you really get things for the little guy is when the big guys want something. So in AI right now, the big guys want something. And we got to make sure we put in all the protections for the little guys in our society. And we got to do it simultaneously, not sequentially, not after the big guys get what they need. That's what this hearing is really all about in the healthcare sector. We welcome everyone, and